Almost 4 years ago, in December 2020, I created this viral video about a racial disparity with a device called a pulse oximeter. My name's Joel, the medical mythbuster, and let's talk about racial biases with pulse oximeters. Pulse oximeters look like this. They're devices that go in your finger and they measure your blood oxygen saturation level. Studies like this one have shown that pulse oximeters are 3 times as likely to show inaccurate, overestimated oxygen saturation levels in patients with darker skin tones. What's crazy is, for decades, scientists have published studies in journals like this one showing that pulse oximeters don't work well in darker skin tones. In fact, this article, which says that skin pigmentation and other absorbers can impact measurements of pulse oximeters, is from 1976. Yet even now, years after I made my first video, the problem still hasn't been fixed. So here's some updates about what's been happening. First, in 2021, the FDA finally issued a warning about the limitations of pulse oximeters and how they may not work well in darker skin tones. In 2022, an FDA panel met to review the clinical data about the accuracy of pulse oximeters. Studies from that year found that the overestimation of oxygen levels in Black patients led to less Black patients getting the care they needed when it came to COVID-19. And a few months ago, in February 2024, an FDA panel met again to review the accuracies of the pulse oximeter. Unfortunately, new guidelines have not been put forth, despite agency officials saying that by September 30th, 2 months ago, they would be. So much of medicine is built off of white, able-bodied male perspectives. That's why it's so important to understand how biases get built into systems and passed down.